Good morning, everyone. East meets West, broadening our medical mindset, is a topic that's needed, especially when the whole world is connected by a common medical flu. Exploring this topic, we will have Dr. Michelle Perro, MD in Integrative Medicine, who will navigate us. Michelle Perro, MD, has been a practicing pediatrician for over 35 years in many aspects of healthcare for children, including emergency and integrative health. She is presently involved with medical education and patient supervision at Gordon Medical Associates in Marin County, California. I am Amita from Nourish Talk, a platform for natural, holistic, and integrated therapies. I'd like to introduce all of you to Dr. Michelle Perro, who's joining us live from San Francisco. Good morning, Dr. Michelle.
Amita, thank you so much for having me. Delighted to be here. Thank you.
Okay, so when you say bridging the divide and navigating the road, what exactly do you mean?
Yes. So what I thought would be a great kind of introduction for listeners on Facebook today would be to explain how, for those of us, particularly here in the US, who have been entrenched in this system of either we call it traditional, conventional, or Western medicine, those names are pretty, synonymous with embracing more of an integrative approach to health. And how do consumers of healthcare navigate this divide, embrace it, and occasionally cross over? That's what I'm going to encompass talking about today. So let's get right into the topic, shall we? And I want to explain how and why we are in our present system of medical mayhem. What has happened to our society? Where did this start? So we're going to start where I started in 1978. It's a long time ago, and still, and I've checked before doing this talk, that medical school teaches a subject called pharmacology, and it's often taught in the second year of a four-year medical school here in the US, and I'm talking specifically about American medical system. And there is an information overload and proliferation of new drug information for students, so much so that they themselves are going to try and then decrease the number of drugs that students need to learn. Additionally, um, nutritional education, which is what consumers, parents want, is not compulsory. When I was in medical school, I received 2 hours of nutritional counseling. Now schools are embracing it more. I've seen medical schools presently where it's as much as 2 weeks, but that 2 weeks cannot be compared with a year of pharmacology. In addition, not only is it only perhaps a 2 week course in nutrition, it's not promoted, it's not taught, it's not in the algorithms that these young doctors are being educated in this model. So it's not in their consciousness. So I present to you studies. Everything I talk about is cited, meaning it's referenced. And this was a study that actually came out that's saying, hey, medical students are being overrun with the number of drugs that they need to learn about. Cut it down. This study said 168. I don't know where that number came from. We could, figure that out further. But I'd like to share with you this. It's called a PDR, Physician's Desk Reference. You can lift weights with that thing. It's a hefty. It's now online. We don't carry those books around anymore. I had to find a 2009 version to show you how much information is in that book. It's everything about drugs. And we used to get it as medical students for free. You can still access it online for free. So we have access as physicians to all this plethora of drug information. However, a paper that just came out over a year ago says we need to increase nutrition in medical education. This was a review presented. There's the reference for those of you who'd like to check, because obviously we have a medical mismatch in the US. We are undernourished but overfed. fed in the US, something has gone awry with our nutritional system, and we need to backtrack and review. As a matter of fact, in Michelle, Dr. Michelle's perfect world, I would have it so that every clinician and health practitioner, MD, would have to take a CME course in nutrition to get their MD license reapproved. That's how I would do it. That's how important this topic is in my practice. So let's talk about what the problem is. I'm going to be transparent. I'm going to be clear. I'm not saying anything radical here today. I am a New Yorker, so I kind of let it all out. You know, I'm now a Californian, a little crunchier, but my roots are in New York City, where we are transparent and we are open for discussion and we can agree to disagree. Big pharma, big money. I think you all can respect that. Now, there is a presence of pharmaceutical companies in medical education. It's more regulated now. In the past, we would be wined and dined. We'd be allowed to attend conferences, get stethoscopes. I have had colleagues who go golfing, and that's changed. There, especially here in California, I think there is a very tight budget. Other states, it's different. But nonetheless, pharmaceutical companies are in medicine. And we as physicians, I'm going to talk about MDs now, we're forced to adhere to something called these clinical practice guidelines. They're called CPGs. And when we deviate off these CPGs, we can get flagged for medical review boards and we get reported, even if it's justifiable in another model, such as an integrative model, which we're going to go into in this talk. And for those of us who want to think outside of the box, we get peer pressure. Recently, in my own community, a physician wrote an article in a journal that some doctors were not happy about, and they wanted to remove her off our local hospital. Just to give you an idea of the pressure that we as physicians can feel when we voice critical thinking that's outside the general box way of thinking about an issue. So this gave me a laugh. And I will share why I chuckle to myself. I'm often chuckling to myself. I read this study and I said, oh, I have to share this. This was an article put out. It's back in 2003 from The Lancet, which is a well-respected journal. And it was the accuracy of pharmaceutical advertisements in medical journals. And their recommendations said, this is right from their journal article, doctors should be cautious in assessment of ads regarding drug safety, efficacy, or convenience, despite being in reputable medical journals and or evidence-based. Now, I'll tell you why I was having a little chuckle to myself, because many of you, even though you may not be clinicians, are aware of a massive study that came out this summer from The Lancet regarding how hydroxychloroquine was not efficacious in treating COVID, novel coronavirus, COVID-2, SARS-CoV-2, let's just call it COVID, and using hydroxychloroquine, and they reported 96,000 patients. Wow, that's a lot of patients. Well, it turns out that this was fictitious. This was not a real study, even though physicians such as Dr. Fauci were already saying, see, hydroxychloroquine shouldn't be used. They were already making clinical judgments based on that study out of Lancet. We also know, digging deeper, there were connections to a Harvard professor, I believe also a physician, but don't hold me to that, who had ties to a pharmaceutical, Gilead, I believe, that makes remdesivir. Remdesivir is an antiviral drug used in being treated with COVID. So you can see how, now I don't want to get into this today, but this is the kind of thinking that as a physician requires, and busy doctors often don't have time for this type of thinking. That took a lot of digging on my part. So I want to show you how this all plays out. Amita. This is something you should be aware of. The average medical school debt for the class of last year is $201,490 from, according to the Association of American Medical Colleges, and that is not even including student debt. So an average doctor coming out of school may be carrying a debt of over $300,000. So much so that organizations are being formed like Dr. Debt, to help students. How, oh, isn't that sweet? We're going to help you with this enormous debt you've just incurred. So now this young doctor is indebted to the wheel. It's going to be very difficult for people like this young doctor to get off the wheel because she has to pay down that debt. So this, to me, is an obscenity to have young doctors straddled with these massive, massive loans. And it's also true for veterinarians. I have a family member from vet school who's also carrying a similar load, where so much so that they had to go back and live back at home with their parents because their debt was so high as a young person who really wants to be out on their own. So you can see this is a problem.
So there are multiple problems that you are pointing out. One is, of course, the money part, that the debt. Then the education system itself. MDs are not taught nutrition and some of the integrative ways that they can, they can heal others. And now when they graduate, they have this astronomical number, that they need to pay off, plus the education that didn't teach them. And now this is like a mismatch complete, right? If you think about it from that angle.
Well said. Thank you, Amita. We have another problem facing physicians. I'm sharing with you my world. This is our world, and this is what we have to deal with, our medical insurance companies. So what do we as MDs have to do? We spend hours on those electronic medical records, those ones that were all in front of the computer when you come to your medical office before we were pre-COVID, before we were on telemed, which I know so many of us are now, to justify insurance. We are so much so on there. I'm going to give you an inside tip. We call it RoboChart. So many doctors are just copying and pasting and putting in the chart so that we can drop a bill for the insurance company. At the end of our day, if you're working for whatever health clinic, I'm not mentioning any in particular here, you can't leave. You have to drop a bill within 24 hours or you will be flagged. Additionally, when we come out of med school, and I've checked, and this has not changed since I graduated in did I graduate in 1982? Yeehaw. That we don't get education on insurance billing. I know. And now, yeah. Can you imagine? And then you, as the patient, get a bill, a problem, and you want us to rectify it. We have no staff to do this. We spend hours during the day, put on hold, have patients waiting, get disconnected on just trying to get your bill sorted out, a procedure covered that your insurance company denied, lab testing covered that was denied. And we are not covered for this time. We are not given extra resources or time to give you all that in addition to whatever letters you may need for your insurance company. This is on our time, our dime. Now, as a physician, and in California, in the state where I live, single payer insurance came up on a proposition 20 years ago. We only got 28% of the population. Medicare for all. This is, Obamacare, Medicare for all, Birdie Care. I say, yes, we need a single payer insurance. It can be something like what Canada has, or in the UK, and France, and we can get rid of this whole idea. Medicare works. So we have to deal with all the insurance complexities as well, Amita, regarding patient care. It's another layer that makes our lives hellish.
Yeah, that's insane. I mean, if you think about it, like, I'm in the software industry, but generally speaking, most of the other lawyers and all, they have paralegal or some assistants or some other things, other people to help them. But for the doctors to sit down and go through what, if I have come to you for something and figure out my lab testing, that's really taking a valuable time from a doctor, which the doctor could be spending with the patient to help them heal, right? That's the whole point.
So this is our world. Here's a typical waiting room. And you can see, all kinds. Obviously, this is a pre-COVID photo. Everybody would be in mask now, or they would actually be at home. So this is what we're dealing with. This is how we start our day, and people are waiting. So they already come into the office angry because they've already had to deal with lost this, missed that, et cetera, et cetera. So this is a very typical waiting room for many clinics that you might be have attended as well. I just want to give you the visual of what that looks like in our world as well. Emails, the bane of our existence. I want to spend 1 second talking about emails. I'm just kind of laying out the west part of the conversation before I get to the east part of the conversation, is how emails have changed physicians' lives. Most because of electronic health records, patients can contact their physicians through emails. And you say, wow, that's awesome, right? I can grab my doc. Well, let's see how awesome that is. So a busy physician in a clinic that sees a lot of patients. I'm a frontline doctor. I've worked at many busy clinics. You may get anywhere from 1 to 20 emails. Now, the average length of an email might be a sentence to 2 pages. And your organization is telling you you have 8 to 24 hours to answer your emails. So when we finish the end of a day, I would normally have started around 8:30. I'd wrap up at 5:30 or 6. I would spend an hour and a half answering emails, or take it home and get back on the computer at night after I already kind of like steamed out my brain during the day answering emails. And many of the emails are complicated. They're not straightforward. Parents, patients are asking lots of complicated questions. Where do I get this? I need a letter for that. You didn't respond to this. What do you mean my lab test of this is abnormal? So there's been another whole layer for many clinicians. I'm talking about doctors on the front line regarding emails. As a matter of fact, doctors, the average physician spends 20% more since the introduction of the electronic health record that is not compensated. So let's talk about how we got here. Did I lay out to you? I wanted to share with you our world. Now that's some generalizations. Not every physician's world is like that, but I kind of painted the scenario on how they got there and what their world is like today. Their world, my world. So let's get back to the Merck manual. It began in 1899. That is a medical manual. I just went online preparing for this talk, looking at it again. There is a professional version and a patient version. You can access it online now for free. And this is what it looked like back in 1899. And if you take a look at that, you'll say, well, gee, that looks like a lot of natural medicine there. And it was. There were herbs, there was homeopathy, there were natural solutions. That is the origin of healthcare for MDs not that long ago, just over a century ago.
Mm-hmm. That's interesting. Very interesting. How Ayurveda and acupuncture, if you think about it, both these medical systems have been around for 5,000 years, not 1,000, 5,000. And people were getting healed, right? If you think about it.
So indeed, and I'm a big fan of both Ayurveda, and I'm a big fan of acupressure, acupuncture, and traditional Chinese medicine, as well as homeopathy, which has been around for at least 500 years and probably even longer than that, 2,000 years. So let's talk about what happened in America. So meet Rockefeller. He was an oil mogul. And at the turn of the century, he said, wait, he found that pharmaceuticals could be made from oil. Now, he sent this gentleman, he wasn't a doctor, Abraham Flexner, across the US to centralize medical education, shift it away from natural herbs and homeopathy to a pharmaceutical-based treatment. And he began finding that the chemicals in plants and natural materials could be patented. Can you plant, penicillin from mold? No, but when you make it into a drug, you sure can. The same thing with various other drugs. Many drugs that we use now, synthetic pharmaceuticals, come from plants, come from fungi, come from bacteria. Correct. So at the turn of the century, let's talk about San Francisco, where my hometown, there were over 900 homeopaths practicing at the turn of the century. After Rockefeller was done and the work of Abraham Flexner, he drove out natural medication and homeopathy, and even some practicing natural physicians, such as homeopaths, were jailed. And so they say this was the reformation of medical education. The question I posed to you and for you to think about, was this the birth of medical education or the destruction? That's the question I pose to you. So back to our roots. I'm a big fan of acupuncture. I refer to patients a lot. Some use traditional Chinese medicine, herbs with that, some don't. But we're going back to our roots. So, what are some of the beliefs as you enter the integrative world? Well, first of all, there's the belief that you treat the whole person, the mind, the body, the spirit, and that every body has within it the inherent ability to heal itself. You have to restore the holistic zone of the mind, body, and spirit to begin true healing and allow the body to heal itself. In integrative care, individuals take part in their own care. This is not a hierarchical, patriarchal, matriarchal system. We are a team. And within the team, there's an orchestra leader. This frustration with the medical system is because Western medicine is not trained in holistic care. It's really hard to ask for holistic care in a system that trains on symptomatic care using pharmaceuticals. And hence, our desire for more natural treatments, when you knock on the Western door, cannot be opened. That's not the mindset. Reversal of chronic disease, that is not how Western medicine was designed. Chronic disease does not do well in Western medicine. Acute, awesome. You get hit by a car, you have a heart attack, you need a surgery for a broken leg, fabulous. Chronic disease, autoimmune disease, there are many shortcomings in Western medicine. Many folks do not want to be on daily pharmaceuticals, and I can't blame you. I don't even want to take daily vitamins, which I do. But this idea of daily pharmaceuticals is particularly caustic for many patients, so that they don't want to do it. That many people express, look at this bag of medication that I'm on, doc. I don't want to do this. And one of my goals when I start treating patients, even children, I am a pediatrician, I have seen many adults, is start to peel back the bag of drugs. When an elderly person comes into the ER, for example, they come in with their bag of medication with all the drug interactions and side effects, and often no one's looking, not to mention cost. There are costs, financial costs for not being well in our system. And in America, I'm not sure how good a job we take care of people with chronic disease. It's being looked at today in our own Supreme Court Justice nominee. And we won't go there because I don't want to raise my own blood pressure today, Amita. So let's move on. And what has got me started on this road many decades ago is chronic illness in children. And children are sort of the stepchild of society, not so in other cultures, but here in America, I believe that people like their dogs more than children in some communities. So I want to say our children are vulnerable. And this slide's a little bit old because some of these statistics have changed. This is why I wrote the book, What's Making Our Children Sick. Exactly for this reason, our children are not well. 1 in 2 children in America now has a chronic disease. So if we look at some of these stats, I'm going to change a few of them. Cancer is still the leading cause of death, and it can take several decades to develop. It would even be higher if it wasn't so slow growing. 1 in 13 children has food allergies, for example, and that's not even considering food intolerances and food sensitivities, gluten, dairy, soy, etc. ADHD, not having your child focus in school, is a massive problem, and Amita and I will be looking at that in the future. 1 in 6 kids has a developmental delay. Very, very difficult to manage. Schools are not prepared, and now many children with developmental disability, they're being sent back to school even ahead of other children during COVID. They're home. And many parents who are trying to work from home do not have the tools to deal with some of these disabled children. Autism, since I wrote the book and this slide was made, 1 in 23 boys now has autism. 1 in 53 to 58 children. Autism is about 4 times more common in boys than girls. Juvenile diabetes and type 2 diabetes is on the rise, as well as obesity, and it depends on state. Anywhere from 1 in 3 to 1 in 5 children is now obese with all the sequelae of obesity. metabolic syndrome, cardiovascular disease, bullying, and the effects of bullying cause disease later in life. Those are called adverse childhood experiences. I think you're getting the picture.
This is alarming. And how the heck did we get here? Is like you said earlier, so many different things. But
well, we can the main way we got here is when we hijacked our food supply, Amita. When we introduced GMOs and their associated pesticides in 1996 to
yeah,
1990, our children are not healthy. And even over 60 years ago, Harry Truman said, a nation is only as healthy as its children.
but that's probably also happening when a late woman is pregnant. So because she's also having that kind of a food, which is GMO pesticide ridden, probably starts at the womb, and then when the child I'm not a doctor, I'm just kind of making some observations, and then of course we feed our kids with all the GMO and pesticide laden food, and that accentuates, or that becomes it so accelerated, all the issues that you just shared here.
Correct. And not only that, Amita, what I'm focusing now on children and not children and parents is pre-pregnancy cleanup. And
Yeah,
before I tell young couples or older couples for that matter to conceive, they spend the 6 months prior to cleaning up
yeah,
and
yeah.
doing a spring cleaning prior to conception.
That's exactly what I was going to say, that before you, in today's day and age, before, if you're thinking of having a baby, you almost have to clean up your system first before you have a baby, so that the baby is healthy, and then kind of go subsequently to the next steps after that.
Absolutely.
Yeah.
We can
Okay.
go. So let's briefly go over what's the difference between these ideas of holistic, functional, you may have heard of that term, and integrative medicine. I just want to share with you, there are so many types of integrative medicine. Frankly, I find it overwhelming how many differences and how many types you can employ. So let's go over some basic definitions. So let's cross the bridge into our world. Conventional medicine, characterized by disorders by diagnosis, symptoms, we treat symptoms, not the root cause. We rely on pharmaceuticals, procedures, surgery, etc. Holistic medicine, and there's crossover between these terms, by the way, is characterized by a focus of treatment the mind, body, spirit. It focuses on the interconnectedness of the human whole. Naturopathic medicine is a system that emphasizes prevention and self-healing using natural therapies, honoring the body's inherent ability to heal itself. And there are naturopathic doctors, those are called NDs. They attend a 4-year to 5-year naturopathic medical school. And there are also something called traditional naturopaths. They have less training and they don't go to traditional naturopathic doctoring school. It's less education. So you should be aware of those distinctions. There's integrative medicine, which is what I call myself, where I integrate conventional and non-conventional medicine. I view the patient holistically, and I always go to the root cause. Why? I often alleviate symptoms using natural therapies. I don't like pharmaceuticals. I have used them. They can be very helpful. I don't throw the baby out with the bathwater, my favorite pediatric metaphor. And functional medicine is a term, I don't like the word. Jeff Bland brought this into play. He wrote, he's really one of the fathers of functional medicine. He wrote Disease Delusion. If you haven't read that, it's a really good book. And it's a personalized integrative approach, usually from a conventional background, arching into root cause holistic medicine. There's the IFM, the Institute for Functional Medicine, and many of my colleagues have sought additional training in integrative medicine through this structure. And you say, well, Dr. Michelle, why didn't you do that? I didn't, because they didn't have anything on pediatrics. Again, children, why not children? I've actually asked them. So I sort of trained myself, and that it's hard to do. It's hard to train yourself in this different modality. Doable, but not so easy.
So acupuncture and Ayurveda would be holistic medicine, because they talk about mind, body, and spirit. Is that, would you categorize?
So let me just get, this is a great segue, Amit. I'm glad you brought that up. Ayurveda, traditional Chinese medicine, osteopathic medicine, chiropractic medicine, um, holistic nutrition, aromatherapy, reflexology, acupressure, um, hypnotherapy, Feldenkrais. You see, there are many ways to try and integrate the system, and many of us have different approaches. For myself, I'm a trained homeopath. It's one of my favorite tools. I train here and in India. Other and it resonates well with me because I find the healing so profound, so gentle, but so effective. Unfortunately, when you look up homeopathy at the Merck manual, it's diagnosed as quackery. I can assure you it's not quackery. It's managed by the FDA, and we've been under attack since the Flexner report. This is not a plug for homeopathy, but it is my favorite tool. And it's under attack again presently, literally as we speak, Amita. So there are many, many modalities, and I'm going to explain how consumers of health care can get into this.
Sure.
So again, what this is, even as an MD, I can learn and help patients integrate mind, body, and soul. So how do you choose? So you say, okay, Dr. Michelle, Amita, I want to get into this. How do I start? Well, Nourishing Doc has a beautiful website you can start looking through in talks. But let me give you some brief guidelines for the sake of brevity. I know you're all busy people. First of all, what type of condition are we talking about? Are you looking for general health care, or do you want to really reverse your autoimmune disease? How complex is the issue? In general, children tend to be easier, but not always. Unfortunately, medical insurance does not cover a lot of the practitioners. It's out of pocket expense. And because these visits take so long, many integrative practitioners charge a lot of money for your visit. And that right there is a turnoff. There are a few clinics that offer integrated care. UCSF has one, Sutter has one, Kaiser has acupuncture, for example. So there is a little bit of integration. And so you can start to see the Cleveland Clinic. There are clinics that are now offering integrative medicine. You want to look at the legitimacy of the practice. Talk to your friends, do some homework, talk to the provider before you engage in what I hope to be a long-term relationship about how quickly do they see change for you. If they say, oh, it's going to take 3 years and $2,000 a month of supplements, think twice. I don't like green pharmacy. There are certain practitioners who take advantage and just swap out pharmaceuticals with green pharmacy, with vitamins and supplements. That's not the idea. That's just called green pharmacy or green prescribing, greenwashing, and it's still not getting to the root cause. You want to look at location. I prefer at least the first visit, a hands-on examination. Many patients tell me doctors don't examine them anymore. Now, COVID aside, I understand we're all doing telemedicine now, many of us rather, but there are so many things I can pick up by looking at the child or your hair, your nails, your tongue, your skin quality, the actual feel of your musculature. How does it feel? And as a homeopath, I'm always looking at your energetic state. What is your chi, your vital force, your constitution? You see, it's so very important for me to see a patient. So these are the ideas that should be percolating in when you start to choose somebody.
And first visit is very important for a practitioner to see the patient in person, especially it's a 90-minute or a 60-minute, session, right? I mean, that's what you're saying. Like it's not possible, it's not advisable, I should say that, to do a telemedicine, a 60-minute or a 90-minute session.
Amita, I prefer to see someone, at least for the first visit. I
Yeah.
get a feel for who they are because sometimes, and I'll explain to you, patients say, um, and I say, well, tell me about this or that. Oh, no, nothing to say. They cross their arms and they lean back. I can tell you there's something to say. I can look and see and look at you and just see. So there are things I can pick up, the subtleties of an interview, and someone can get to know me. Am
Yeah.
I the right person for you? It's not always it's like if you don't jive with that person for whatever reason, I would
Mhm.
suggest you cut your losses. You want to feel that there's an equal exchange of somebody who you want to work with for a while.
Yeah.
It takes autism, it takes 1 to 3 years to reverse autism. It takes 1 to 3 years to help somebody with autoimmune disease, Hashimoto's, rheumatoid arthritis. These are not quick.
Yeah. Yeah.
So choose the type of practice that resonates with you. The practitioner is the orchestra leader of your care, and you want to choose somebody in your budget. If you're on a tight budget, some of these practitioners will not work for you. So, what I tell people is if you're on a budget, one of the best ways, in my experience, per my opinion, is to work with a holistic nutritionist. They are often so well versed in diet, and because food is medicine and it's my first line of treatment for patients is their diet, this is often a good place to start. And they are often more affordable than integrative MDs, naturopaths, etc. There are also low income acupuncture clinics where they'll charge you $20 for a visit, set you up, and they have many patients like in an open room, not with COVID right now. So they call it community acupuncture. You can see if that exists in your community. So you can kind of work within that. And if
Mhm.
you're over 65 and you have Medicare, there are some integrative practices that do accept Medicare. Here in the Bay Area, there are two. So you have to look at the budget. Now, as you work with your integrative practitioner, whether it's a naturopathic doctor, a DO, a chiropractor, or a holistic nutritionist, wherever you go, maybe it's your acupuncturist who knows TCM, maybe it's your Ayurvedic practitioner. You may need an MD who is open minded, who can work with you. So, if you're working with an acupuncturist, for example, and they would like you to get certain lab tests, they can call your MD and say, hey, can you get a vitamin D level on Amita, etc. There can be an exchange, and the MD can assist and utilize that high insurance you're paying for, rather than you paying for insurance and medical costs. And that's what happens for a lot of patients.
That's, I think, the problem in the United States is that, if I'm paying, I don't know, $200-300 a month for insurance, and now, and I go to a regular conventional medication, and I don't want to take medication, and I want to go for acupuncture or homeopathy or Ayurveda, and now I have to shell out more money. So it's from a user point of view. I'm a user. It's so frustrating, right? I'm so confused. What am I supposed to do, and who am I supposed to go for, right?
Well, indeed, it is a marathon, not a sprint. So people say to me, well, okay, Dr. Perro, you gave us all this great information. Well, what do I do? You're in for the
Yeah.
long haul. But I say, oh, whoa, what are you eating? Start with your diet. Are you
Yeah.
living on out and beer and wine and alcohol consumption during COVID? Whoopa, way up. So we, st- we, I start with a diet 100% of the time, and there's no way around that. And
Yeah.
so what I say is start with your diet, eat only organic, regenerative agriculture. If you have anything related to your gut or autoimmune, I would come off gluten and dairy to start. And I'm giving you that tip. This is not a prescription for any illness. I'm not giving medical advice, but I can say I'm just giving you an idea how,
Mhm.
through your own manipulation of your own diet, look at what you're eating. Do you eat any vegetables? I have people say, oh, I eat vegetables. And they're talking about ketchup. Ketchup is not a vegetable. And as a matter of fact, tomatoes are a fruit. But okay, that does not count. So people think I eat a lot of vegetables. I have vegetarians who say, I'm vegetarian. I call you a carbitarian because they're eating big bowls of pasta with cheese and they're not really vegetarian.
That's
So
right.
the best food I've ever eaten were in two countries, China and India.
Mhm.
Yes, in India, I ate vegetables and legumes. It was beautiful. In China, I ate so many fermented vegetables. It was beautiful. Yes, they did not have organic. Organic was not so where I was in Beijing. I was in Mumbai. It was not a thing. But I think you can overcompensate for lack of organic when you eat a lot of vegetables. So I recommend a heavily plant-based diet. to start, whether it doesn't have to be, you can be an omnivore as well, but plants should predominate your plate. They predominate mine. So if you need to find me, you can go to my website. I'm an executive director of www.gmoscience.org. I help co-found that organization, science-based, looking at the effects of GMOs and pesticides on health. I co-wrote this beautiful book with my amazing colleague and friend, Dr. Adams. She's a medical anthropologist at UCSF. Even though this book came out 3 years ago, November, I can't believe it, I find it still relevant, and you can give it to your pediatrician. And of course, I thank Nourish Doc for inviting me today and look forward to future conversations with all of you regarding our health.
Any questions? I see people in Zoom. I've stopped sharing. You can ask any questions. I do see live audience in Zoom who have logged in. So I want to give them a chance to ask any questions, any feedback, any comments before I sign off. This is all confidential. I've stopped sharing, so you can ask any questions. Nobody's going to see. I'm going to say the question out loud, but nobody's going to see your name. So I want to wait for a moment if anyone has a question here. But excellent discussion. And Dr. Michelle, I think what we want to do is we really want to have you come back and educate parents, as you and I were talking about earlier on ADHD, parents whose kids have ADHD or parents who have kids have autism, they are they're struggling to get, what is right for them. And I think like I said, I'm just a consumer, but I think there's a lack of education that someone like you can bring it to the table to so many people out there, so many parents out there, how they can do integrative medicine or, natural medicine to help with their kids. And that's what we would really like for you to start that process, hopefully next month.
Absolutely. At this point in my career, if I see kids in the clinic, how many can I see in a day? There's no finite number. That's why I wrote the book, to reach a broader audience. And again, and we did. But however, I'm thinking, wait a second, these podcasts and webinars, this could be a bright light of COVID, because a lot of people are on their computers all day. So perhaps we can continue to educate. It's not my favorite format for educating. I like live interacting with people. However, we can broaden people's knowledge, and I want to tell folks also, I am a on the front line doctor. I treat patients. I'm not a lab researcher. I spent my whole career taking care of people, and because I was one of those doctors in debt, not like now, but debt of many years ago, I had a lot of jobs. Well, don't feel sorry for me. This is not the violin. I saw lots of patients. I got my clinical acumen got quickly elevated. So I have a lot of respect for practitioners who see people. Those are the people I listen to. I read the studies, but I also listen to my colleagues on how we treat people. People are not necessarily lab rats. Well, some of us are, but we treat people.
That's excellent. Excellent talk. If I don't see any questions right now from the audience, you can let us know. I had put up our last slide. Our email was there, care@nourishdoc.com. Please feel free to give us feedback on how we are doing. We do a lot of educational sessions, and we are starting with group workshops in November timeframe. With that, I'd like to wrap up the session and thank Dr. Michelle for joining us this morning. Thank you so much, Dr. Michelle, for being with us.
Thank you. It's my pleasure, and I look forward to future conversations. Thank you.
Absolutely. Thank you.